Everyone, so we're back today doing a little nasotracheal suction. Prior to suctioning any patient, you want to verify in the chart there are no contradictions going on, no epiglottitis, no bleeding disorder, no laryngeal spasm, and I verified in my patient chart none of that's going on, and it's actually a little time for them to be suctioned. So I'm going to do that. I'm going to go ahead and knock on the patient's door, get permission to come in, introduce myself, let them know who I am. Let me go ahead and identify my patient, make sure that I'm dealing with the right patient. I am dealing with Miss Hello Kitty. Looks like her date of birth is going to be 10/16/63. Okay, and so I'm going to know how I'm going to suction her today. Just get a little familiarity, what's going to go on. I have my suction kit here on, and this is actually using the patient's tray in here that they, and it's clean surface, taking everything out. Okay, so I'm going to have to put a drape across their chest here. They are on oxygen, so I'm going to move them up to 100%. I'm also going to go ahead and connect my suction catheter, not suction catheter, suction tubing to the suctioner. Lay that tubing there. I'm going to go ahead and place a clean glove here on my dominant hand, which is my right hand. I'm going to place a sterile glove on my non-dominant hand, which is my left hand. I'm going to go ahead and grab the suction catheter with my with my dominant hand. I'm going to grab the top of it here, and my non-dominant hand I'm going to use to actually. I'm going to hook this up to the tubing. We're going to take our normal saline that we had in the tray here, and we're going to just make sure our suction catheter is working properly. Now, in placing this in a person's nose, you want to go ahead and go through the nares, all the way down here to the septum. I'm actually feeling a little resistance, so I'm going to pull back a centimeter or two by gently twisting. And I'm going to go back down. Okay? I'm going to go ahead and suction 10-15 seconds. Go ahead and gently twist, bringing it out. Now, I want to go ahead and clean this catheter out when I take it out. So I'm going to place it back in this normal saline here. There. I'm going to wrap this suction catheter up in my clean glove to be properly disposed of. I'm going to go ahead and ask my patient to cough. Take off my sterile glove. Remove my suction tubing from the suctioner. I'm going to go ahead and place the patient's mask back on and adjust our leader flow and the oxygen from 100% back to the leader flow they were on. I'm going to go ahead and assess my patient's cardiopulmonary status. Make sure I clean up my mask. Tidy up the room. Find out if there's anything I assist the patient with. Go ahead and chart on the patient to make comparisons between after suction the patient and prior to.